Physician Focus. I'm Dr. Mavis Jaworski. The physician-patient relationship in primary care medicine is generally regarded as the foundation of good health care. Ideally based on mutual trust and respect, a good relationship between a physician and a patient can last for decades and give a patient confidence in the quality of care he or she receives. Yet the physician-patient relationship, like medicine itself, is constantly evolving and changing. This edition of Physician Focus will discuss the elements that make a good physician-patient relationship in today's world of medicine. Focusing primarily on primary care, we'll look at such questions as how has the relationship evolved over the years? What are the elements of a good relationship? What factors can disrupt a relationship? And what should patients think about when seeking a new physician? And what will a relationship be like with the advent of new healthcare models, such as the patient-centered medical homes and accountable care organizations? With me for our discussion is Dr. Dennis Dimitri, a board-certified family physician in Worcester, Massachusetts. Dr. Dimitri is a clinical associate professor and vice chair of the Department of Family Medicine and Community Health at UMass Memorial Medical Center and UMass Medical School. A past president of the Massachusetts Academy of Family Physicians, he is currently vice president of the Massachusetts Medical Society. And I'm so pleased to welcome him today. Welcome, Dr. Dimitri.
Thank you very much, Mavis. It's my pleasure to be here today.
I'm going to be referring to you as Dennis. I hope you don't mind.
Well, I hope you don't mind that I called you Mavis.
Not at all, not at all. You know, one of the things I realized as I was doing the intro, it would help our viewers to understand what we're referring to when we talk about the patient-centered home and what's happening with that, and of course the accountable care organizations.
Well, the patient-centered medical home in many ways represents a rejuvenation of a traditional way of providing care to patients that goes back many, many decades. The theory is that if patients have a good relationship with a primary care doctor, a place where they know they turn for their first contact of care, where they can have continuity of care, and where their care in other parts of the medical system will be coordinated for them, that place will act as their home, their medical home that will meet all of their needs. The patient-centered medical home is mostly around the area of primary care, but it sits within these larger formats of the organization of medicine that we're seeing now that are referred to as accountable care organizations. And in an accountable care organization, what patients will find is the full breadth and spectrum of all the kinds of care that they may need, starting with that first contact that will occur with their primary care physician in the setting of a patient-centered medical home, but including the various kinds of specialists and subspecialists that they may need for other needs of health care, and hospital care, be it at a community hospital or perhaps at an academic medical center or teaching hospital where they may need to go for subspecialized care. In an accountable care organization, all of that will be brought together so that patients will be able to start in one place and get all of their care coordinated in the way that they need it.
I think for some patients, they have actually asked me about this patient-centered home, and they're curious if offices are going to be moving to new locations because of the term home being used.
Mm-hmm. The patient-centered medical home is probably more about the structure of the way the care is delivered to patients rather than the geographic location of an office. And we have many practices across the state now that have made the kinds of transformative change in the way they're delivering care to patients so that they've been able to meet the certification or qualification by organizations such as the National Committee for Quality Assurance for certification as a medical home. And I think that what patients will find if their PCP's practice has been transformed into a patient-centered medical home is that the care will be delivered by a whole team. The physician may be leading that team, but there'll be nurses, there'll be people in the front office, there'll be medical assistants, and there may be others who will be involved in delivering the kind of care that the patients really want and need, and they'll be able to get it where and when they want it.
I'm sure that you have been in settings in the past, whether it's in an airport or at a family gathering, where someone comes up to you and they say, I've got to find a new doctor. Can you help me? What do I do in finding a new doctor? How do you usually respond to that?
Well, certainly it's something that should be taken very seriously. Choosing a primary care doctor for yourself is probably one of the more important medical decisions that you might make over a period of time. The traditional and still tried and true way that many patients find a new primary care physician for themselves is to ask their family and friends. Particularly if they're new to a community, there may be people that they know who will be able to say, you know, I've got a doctor who I think will really be right for you. They may also say, you know, I've got a doctor who's right for me, but I know you pretty well, and I think there's somebody else who would be a better match for you. One thing to keep in mind is that there's probably no one doctor who's perfect for everybody. You have to find the person who's right for you.
Exactly, and I think that is very important to stress to people that it is a relationship. And sometimes relationships do not necessarily work. And it's not because either party is a bad person, it's just not a good fit. So you want to try to find a good fit. Mm-hmm. And the way to do that is to ask around. But then again, you still have to try and see. You
do. There are other things that you want to take into consideration as well. For some people, it may be important to have a physician who's the same gender. Mm-hmm. For others, it may be that they want a physician who's young, or they want a physician who's got a little gray at the temples and perhaps they think of as more mature or seasoned. That's not going to be the same for everybody. Geography plays a role too. If you're able to find a physician that's someplace close by where you're going to be readily able to access them when you need them, that's certainly much better than having to travel across several towns to a physician office location that won't be so convenient for you. So all of those factors, I think, are things to take into consideration and that will play into your final decision about choosing the right doctor for yourself.
I think also availability of office hours, because in this day and time there are so many people now where you've got two people who are working in the household, and so you have children who are sick and you've got to take them in to be seen. Mm-hmm. You know, how do you juggle that with your work so that you don't take off work? You know, are there any late office hours? Are there any Saturday morning hours? That type of thing as well.
Exactly, and in fact, the patient-centered medical home that you referred to earlier, one of the major precepts in the transformation of practices so that they are more like medical homes is to try and create systems that will allow for better access for patients when they need it. And more and more, I think that practices are becoming responsive to the needs of patients for care that's outside the traditional 9 to 5 hours, that's outside the traditional Monday through Friday work week. Things come up at all times of the day and on all days of the week where patients need help, and so practices are more and more trying to figure out ways to accommodate that so that patients don't feel forced to have to access what might be inappropriate emergency department care for issues that are probably better taken care of in their own primary care physician's office.
Also, there are some patients who want to be seen locally by a primary care physician, but then they want to go to a hospital in another town. Mm-hmm. And sometimes that doesn't work with insurance carriers, and also for convenience. Let's talk about that a little bit.
I think that, you know, you do have to consider the reality of things such as your insurance coverage, what network of hospitals or doctors might be included in your insurance, and how that's going to play into some of the decisions you're going to make. Most insurances that you might have will certainly have options for you to get specialized care in tertiary care medical centers if that's what you really require. But frankly, most of the time for routine inpatient care, one may be better served by being able to get that service at your community hospital that's in the town where you live, in the neighborhood where you reside, and where your doctor may be more closely associated and affiliated with the practitioners in the hospital.
I think that's very important because, as you know, when you work with somebody, you feel comfortable that you can pick up the phone and say, I've got a patient, could you see this patient for me? Or did you see Mrs. So-and-so? What did you think? You can bump into them in the hallway. Mm-hmm. You can chat about the patient, whereas if they're going to a hospital that's far removed, you don't have that type of one-on-one relationship, an ongoing relationship with the specialist.
Exactly, and if there's going to be a good and productive relationship between the primary care physician and the patient, one of the things the patient should hopefully get out of that is the fact that their primary care physician will act as that intermediary for the patient, between the patient and their and the specialist from whom they may get care, and that's a important piece of the role that primary care physicians can serve for their patients.
I think it is absolutely, for sure. Let's talk a little bit about different styles of practitioners. We mentioned, different gender or different age, but what about different styles? Because for some patients, they really want to be more directive in their care, and there are other patients that would like to sit in the back seat.
Well, in all honesty, I think nowadays we see fewer and fewer of that second group who want to sit in the back seat. Not that many years ago, the primary model for the physician-patient relationship was really a much more paternalistic one. I'm the doctor, I'm the content expert, and I will tell you what you should do. In this day and age, frankly, that doesn't fly much of the time. Patients think much more independently, want to be much more involved in the decision-making around their health care. They have a lot of resources. They have the ability to search information about their problems, their symptoms, their medical conditions. And so they oftentimes come to the doctor's office with a lot more information than may have been the case a generation or so ago. So the relationship between physicians and patients has clearly evolved over time. We've gone from a model where that content expert, the physician, imparted their expertise to the patient, and the patient expected to just follow the doctor's orders, to a model where there's much more shared decision-making, where doctors try to interview patients in a way that motivates the patient to be much more proactive and involved in their own care. It's not just a matter of me saying to you, I think you better eat less and exercise more. It's a matter of me trying to figure out, how can I get you, my patient, to want to eat better and exercise more.
Right. It needs to be integrated within the patient, a full understanding of that. So is there such a thing as a perfect patient?
Well, I don't think there are any perfect patients, but I know there aren't any perfect doctors.
That's right.
The evolution of the relationship between a patient and his or her doctor is one that takes place over time. And oftentimes these relationships may, right from the beginning, turn out to not be a good match. It may have to do with style, it may have to do with values, but if you find early on that you're not a good match with your doctor, it's okay for you to make a decision that I want to try and make a change or go somewhere else. Interestingly, sometimes early on in a relationship, everything feels like it's going great, but 5 or 10 or even 20 years down the line, things may evolve in that physician-patient relationship such that it's not working for you as a patient the way it used to. In that setting, it probably would make sense for you to talk to your doctor a little bit about that. If you feel like the relationship with your physician is no longer working for you, you no longer feel like you're getting what you need, it's okay to let your physician know that. Sometimes your physician may not even realize that the relationship has changed in such a way that it's no longer working for you as well. And if you talk to them about that, they may be able and willing, in fact, they may be interested in wanting to make the change that's necessary to get that physician-patient relationship back on track again.
Well, I think sometimes it's also not just the relationship that the patient has with the physician, but it may be a key support staff person within the office. And they may have had a very good relationship with that person, and then that person leaves, and you have someone new working in the office, and they feel that loss because they knew they could speak with that office manager or front desk person or that medical assistant, and they had a rapport with them. And I think it's important for physicians to invite patients to give them feedback on how they're interacting with the home, or patient-centered home, or the office. Is everything fine? Because obviously a physician cannot have eyes on everything at all times, and it really behooves the patient to make a point to communicate with their physician if things are not working just in the communication with the office.
You're absolutely right about that. And my personal experience as a physician who's practiced now for a little over 30 years backs that up. I have found that very frequently patients call the office and they don't necessarily ask to speak to Dr. Dimitri. They'd like to speak to my nurse because that's the person with whom they've developed a very important relationship. Right. That's the person who oftentimes knows the patient in ways that I may not. That's the person who oftentimes has helped that patient overcome certain problems or barriers in ways that have been extremely helpful to them, as well as the rest of the support staff in the office. If patients are greeted by a person at the front desk with a smile who remembers them and knows their name, that is a tremendously important piece of cementing the patient's feeling that this really is their medical home.
And I think it's important for patients to understand that they feel that they can be heard, not only in times of stress, but at other times, that organization really cares about them as an individual, as a person, and it really is like a family to you.
Absolutely. And in fact, with the evolution of the patient-centered medical home, with the development of accountable care organizations, one of the things that I'm sure many of the folks listening in on us have read about and heard about is the movement from medical systems that were based on the volume of work that was being done towards the quality of the work that's being done. And I think this is one of the really critical things that is going to have a positive impact on the physician-patient relationship. Patients will be able to know that their doctor is working on their behalf to improve the outcome of the quality of care that they're receiving, because that's the way the quality of care that the doctor delivers is going to be measured in the future. And I think that will do nothing but enhance the overall health of our patients and also continue to change that physician-patient relationship in a way that's really about trying to figure out what's best for the patient.
I think we should also cover some of the basic points for patients. Say someone who is looking for a new physician, they decide, okay, this is the physician I'm going to see. They call and they make an appointment. One key point is to notify your insurance carrier and to get your medical records. And it's surprising how often patients are not aware that these are necessary things to do to secure them. And sometimes it takes a period of time to get medical records from, say, a former physician. So I think that's an important point. But also, what are the things that a physician needs to do when, say, things are maybe not going right with the physician-patient relationship? What does the physician do?
Well, this is sort of the other side of the coin from what we talked about earlier in terms of what should a patient do when they feel like they're not getting what they need out of the relationship. Sometimes it's the physician who starts to become frustrated by problems with the relationship. And the frustration is usually around the issue of, I'm trying really hard to help this patient get better, to help them control their diabetes, to help them improve their lifestyle in ways that will result in better health for them, and I don't seem to be succeeding. And it makes me stop and think, why is that? And most of the time, it's not because the patient doesn't want to work with their physician, but there may be other barriers there. And from the physician perspective, it's important that we try and explore with the patient what those barriers may be. For the person who, for instance, seems to keep missing too many appointments, maybe the problem is that they can never get adequate daycare for their kids so they can get in for their appointments. Maybe the problem is that they've lost their job and they don't have enough money to have a car to drive to your office anymore. There could be a lot of factors that play a role. Maybe they're going through some very difficult and stressful family issues, an elderly parent who's no longer well, a spouse who's lost their job. There are many, many factors that could be impacting what's going on. And that's frankly the time when the quality of that physician-patient relationship may pay its greatest dividends. If the physician and the patient have over time been able to talk about all these things in an open way, I think the physician will be in a much better position to help that patient understand what changes they need to make and why, and help them to be more successful. And the physician will have a better understanding of what the barriers are for the patient. It's not that the patient doesn't want to work with you and doesn't want to be successful and change. It's that there are things that are impeding that, and we need to help them figure out what they are.
I think a really important point to stress as well is patients need to understand how much we really care about them. And so when they're going through a life stressor, let us know, because we want to help you through that process in whatever way that we can. And I think sometimes patients feel like, oh, I'm just here for a prescription, or I'm just here for this. But if there's something going on in your life that's significant, it can impact your health, and we want to be able to help you.
Absolutely. There's much more to a person's health than just what's their blood sugar level and how high or well controlled is their blood pressure. And it is true that there's always going to be a little bit of constraint around how much time the physician and the patient can actually spend in that exam room together. But if some of that time is used to inform the physician about some of these other issues, oftentimes the physician will be able to say to the patient, you know, I'm going to ask my office nurse to be in touch with you again next week to find out how you're doing around some of these things. Or I'm going to ask one of the support staff at my front desk to make sure they get a hold of that specialist that you've been trying to get an appointment with and help facilitate that appointment.
Exactly.
And that's where the team of the entire primary care office comes into play.
Yeah. Doctors really do want to, quote, be bothered with that information. I say bothered because so many patients, I've had family members come up to me and they say, well, I don't want to bother the doctor with that. They don't understand. That's part of their health, and we really want to assist them in whatever way that we can.
Right.
How can a patient maximize that valuable time they have with their physician and make it the most productive?
Well, I think one should try and come to their visit with their doctor as prepared as possible. And some of it is fairly obvious stuff. If you have a long list of medications, bring that list with you. Make sure it's accurate and up to date so that you can share it with your physician. That's particularly important for those patients who see more than one doctor, because that medication list may have changed since the last time you saw your family physician. If you've got some very particular specific issues that you want to make sure get addressed, write them down on a list and put the most important things at the top of the list so they don't get forgotten. All of us have had the experience of, as you're walking out the door, oh, by the way, doctor, one more thing.
Yes.
Try to bring that oh, by the way thing up to the top. Don't be afraid or embarrassed about issues. If they're important to you, bring them up to the top of the list and make them important to your physician as well. The other thing to keep in mind, and I see this particularly a lot of times with some of my senior patients, is if you have some issues with ability to hear or understand, don't be afraid to ask the doctor if you can bring a family member or a friend or a spouse or whoever it is into the room with you to make sure that all the information is conveyed accurately so that you don't forget things on the way home. I think most physicians are more than happy, if a patient wants us to do this, to share some of that information with another important person in that patient's life so that we can be sure that our advice is heard and recognized and acted upon.
Well, that brings up another thing. Sometimes you have a patient who has some disabilities, and they may have a spouse who also has disabilities with their memory as well. And in situations like that, it is helpful if you provide at least a release to the physician's office of children that can be contacted and medical information that can be shared with them.
Absolutely. And for those who have many children, sometimes it's important to identify who the child is that you want that information to go to, the adult child. And
as the point person,
right.
Not all 7 children.
Exactly. And we've all had that experience where the adult child who's been in California for the last 30 years calls up and wants to know, what's going on with Dad?
Exactly, exactly, for sure. We are just about out of time, and I'm sure that you have one last pearl you would like to share for our viewers about the physician-patient relationship.
Well, I think what I would emphasize is that going as far back as even the time of the ancient Greek physician Hippocrates, after whom the Hippocratic Oath is named, that it was clear that the relationship between the physician and the patient for whom they are providing care is really sacrosanct. That relationship is the critical element in patients getting the care that they need. And even in ancient times, when there was so much less that could be done with respect to medications or technology, people understood that just having that person with whom they could talk honestly, from whom they could get advice, would have a positive impact on their health and their well-being. And that piece is not a heck of a lot different today than it was 2,000 years ago.
Right. I want to thank you so much for joining us today on Physician Focus. I'm sure we've got a lot of people out there chatting now about the conversation we've just had. I thank you so much. I know you're very busy and really appreciate the time you've shared.
Well, it's my pleasure. Thank you for having me here.
Thank you, Dennis. For more information about our subject of physician-patient relationships, visit the websites that are listed at the end of our show. And to view past Physician Focus programs covering a variety of healthcare topics, visit our website at www.physicianfocus.org. I'm Dr. Mavis Jaworski. Thank you for watching.
I'm Dr. Dennis Dimitri. One of the most important medical decisions a person can make is choosing a primary care doctor, one who provides your overall care and coordinates care for serious or complex conditions. You should consider many factors when selecting a new physician, but there are three that I think should be at the top of the list. First, make sure you feel comfortable with your doctor, that you can develop the critical elements of trust and respect that make a physician-patient relationship work. Second, focus on communication. Does the doctor listen to your questions and concerns and respond with adequate answers? Third, decide what kind of relationship you want. Do you want the doctor to make decisions for you, or do you want to make a more active role with someone who will engage in shared decision-making? A good relationship with a physician can last a lifetime and offer confidence in the quality of your care. For more information, visit the Massachusetts Medical Society at massmed.org.
I'm Dr. Michael Berry. For many medical problems, there's more than one appropriate option for testing or treatment. Determining which option to choose may be one of the most important decisions a patient will ever make. Yet too often, patients make decisions without a thorough understanding of their options. Shared decision-making can help. It allows patients and their providers to decide together based on the best scientific evidence and the patient's values and preferences. The Informed Medical Decisions Foundation has worked with a company called Health Dialogue to develop more than 30 programs on various aspects of medical care. These programs help patients work with their providers to make care decisions mindful of what patients most care about. Among our programs are those for cardiovascular disease, chronic conditions, breast cancer, mental health, end-of-life care, and screening and testing. I encourage you to learn more about how to get health care that's right for you by visiting our website.